Hey guys, welcome back to the channel. Today I want to share another taping technique with you for DeQuervain's Tenosynovitis, which is a tendonitis or kind of a swelling of the synovial sheath of the tendons in the thumb, both the extensor pollicis brevis muscle, which is going to help extend the MP of the thumb, and then the abductor pollicis longus muscle, which is going to help you to do kind of those abduction movements of the thumb, okay? So that's what we're going to talk about today. All you are going to need for this awesome technique is going to be a roll of tape and some scissors. Let's get started. So I use Kinesio tape to help decompress the first dorsal compartment and provide a little bit more space in that area, which is going to help with the pain relief and helping to kind of decrease their painful symptoms right away. But it can also be used as a pretty helpful proprioceptive feedback mechanism or kind of a cue for your patients so that if they're starting to feel that tape pull on them, that's a signal to them to stop moving in that plane. And that's where you can educate your patients too. When the tape starts to pull on you, that's when you know you're going to stop moving in that plane. That's too far. Otherwise, you're going to cause strain in that area. So we're really just doing a little bit of decompression, kind of trying to relieve that space. Or kind of create a little bit more space for those tendons that are really just getting mashed down right in that first dorsal compartment. So that's what we're going to do. We're going to have 2 strips of tape today, and I've already pre-cut my tape, but I'll kind of show you exactly what I've cut. So I'm going to use about 6 boxes, one nice long strip that I've kind of cut down. So I have a pretty long forearm, so that's why I'm going to use about 6 boxes, but it's just going to depend on your patient. You're going to measure kind of essentially from the base of their first proximal phalanx on the thumb, and then kind of you want it to go to about that lateral epi or that kind of common extensor tendon. So there's going to be a little bit of stretch on it. It doesn't have to be all the way, down the arm. Because the tape will be stretched about 25%, but you want it to be able to reach pretty close to that common extensor tendon. So I've got that piece cut, and then I'm also going to have a piece that's about 2 boxes. My wrist isn't that wide, and I don't like to take it all the way around so that the tape is kind of like a circumferential thing. That's just my personal preference. So I always cut about 2-3 boxes just depending on the width of their wrist, but I'm going to take it, leaving kind of that ulnar border of the wrist open. So that's just my preference with it. Yeah. So we're going to start with our long strip here. And so as you can see, I've cut it into a Y strip. And basically what I did, I actually tapered the end right here because just so it contours to the thumb a little bit better. So because it's going to be starting right about in this area, just want it to fit my thumb a little bit better, so that's why I chose to taper this end here. And then I left about 1 inch before I started kind of cutting my Y strip so that I have a nice inch of an anchor that's going to be no stretch. And then I've cut all the way down in half and rounded my edges. So I'm going to start by laying my anchor piece down, and again we're going for the lateral side of the proximal phalanx of the thumb at the base. And so for this one, you don't want your patient to be in any kind of position of stretch. So you just want them to be nice and comfortable, relaxed. So I'm going to show you in this direction here. Just make sure that you're not touching the tape so that it sticks better for them. You're going to attach the tip right here, and then just go ahead and smooth out the edges. Again, no stretch. We're just trying to get it to lay down nice and flat, no wrinkles. Right there. Okay, I'm going to start with my back piece here, which is actually, this piece right here, which is going to be the piece that follows along the extensor pollicis brevis muscle, and that's going to wrap all the way around the arm and head back to that common extensor tendon. So that's the way that we're headed. For this piece of tape, you do want about a 25% stretch on it. So you're going to position your patient in the position of ulnar deviation and a slight amount of flexion if you can, as much as they can do without having a lot of pain. You're going to pull the lip up from the tape here, and then just gently, carefully with no extra tension, just really painting the tape down laying it down as you go along, nice and smooth, all the way around the arm. And we're aiming for our common extensor tendon. We're going to end it right about there. So that's what we've got so far. We're going to go ahead and kind of smooth it down and use that adhesive backing to kind of get the tape to stick a little bit better, okay? We'll go ahead and do our base as well, or our anchor at the same time while we're here. All right, so that's what we've got so far, okay? Now I'm going to take this second strip of tape that's going to follow along the abductor pollicis longus muscle. Again, you want your patient to be slightly ulnarly deviated and slightly flexed as much as you can. And we're aiming to kind of end our tape right between kind of the ulna, the radius, because we know that that abductor muscle, it attaches in that area, okay? So again, you don't really want to kind of overlap your tape too much or kind of anchor it to the tape, so I'm going to try to end right before the tape. So let me get the lip back here and get my position. And again, just go ahead and paint the tape down. We're not putting any additional tension on it, just from that position of stretch that they are in, and gently painting our tape down along the forearm. Kind of follow along that pathway. And then I'm going to actually end my tape right about here, so I'm going to trim off this little bit of extra here. Just like that. And it's not a perfectly round edge, but that's okay for me. So for your patient, you'd certainly want to finish that as a round edge. And I'm just going to go ahead and do my little friction on the tape to get the adhesive to stick a little bit better. And yeah, that's what our long piece of tape is going to look like, okay? So we've got one nice long strip following the extensor pollicis longus muscle from the base all the way to the extensor tendon. And we've got one piece of tape that's coming down along the pathway of the abductor pollicis longus muscle, okay? So we're ready to do our 2-inch piece now. So that is going to go right over their most sensitive area, usually right around that first dorsal compartment. Sometimes you'll have people who are ultra hypersensitive. They don't even want to be touched in that area, and so we still want to help them to kind of get some relief or some decompression, but they might be too sensitive to have about a 50% stretch right on top of that area that's hurting them so badly. So in that case, what I would do is actually just fold my little piece here and cut a little, like a little half circle, so that you'll have a little donut hole right in the middle. That way you can center that little hole right over the piece that is hurting them the most. That way they'll get the stretch right around it, but they're not having that tactile, that tape right on top of it, which might bother them. So that's what I would do in that case. But if somebody is not ultra sensitive, they're just kind of a normal typical presentation, then you're just going to take your little piece of tape here and tear the paper right down the middle. That way you're going to be able to kind of pull back either side and give it a nice 50% stretch on the tape, okay? So I'm going to try my best to do this one-handed. Obviously you wouldn't want to do that on a patient. But I'm going to essentially just kind of pull it back, and then I'm going to go ahead and stick it down right there, because that's where I am the most sensitive, okay, if I'm somebody with DeQuervain's. And so this piece right here is that 50% stretch, and then with your anchor pieces here on the ends, you're just going to roll them back, no tension. So just like that, okay? And mine went a little bit further than I would have liked. It's ending right on that ulnar styloid, so that's not perfect, but for the purpose of this video, it's going to be okay. Okay, and then again on this side of the wrist, on the volar side, we're just rolling that tape back. Okay, and I just couldn't get quite enough stretch on this piece to make it go as far as I wanted, but that's okay. You get the idea, right? So that's what it's gonna look like. So we've got our long Y piece and then our little I piece coming across the wrist that way, okay? All right, that's pretty much it. So we know that tape is not a cure, but it's a great adjunct to therapy, and it's something that can really help your patients in between your treatment sessions. It's something that you do want to make sure that the skin is nice and clean before, so either prep the skin with an alcohol wipe or have the patient thoroughly kind of wash their arm with soap and water just to get the excess oils or any lotions or things like that off of it. That'll help the tape to stick a little bit better. Most times the tape will last like between 3 to 4 days, just depending on kind of what the person's doing, but they're welcome to swim or shower or wash their hands, do dishes, whatever they need to do, that's fine with the tape on there. If they start to feel rashy or itchy, the tape is irritating or painful, anything like that, I just advise people to go ahead and take it off a little bit early. I hope this video was helpful. Thank you guys so much for watching. If you like this video and you want more content about hand therapy, taping techniques, different diagnoses, exercises, things like that, go ahead and subscribe to the channel, and I'll see you next time.